Hi, my name is Dr. Raúl Enad from Cadenza Medical Clinic, Ave Maria, Florida. In this video, I'm going to talk to you about the story of a young woman, 36-year-old. Her name is Teresa. She was diagnosed with early onset colon cancer at the age of 36. When I saw her in the hospital, she already had been diagnosed for a year with liver metastasis, colon cancer with liver metastasis. Why a young woman like this, full of life, developed colon cancer? It turns out there's a new trend, early onset colon cancer. And not only that, it also has been noted that there is a rise of this the cancer of the appendix. What is happening in the health of this young woman? Teresa is a graphic designer. She enjoys life. She exercises regularly. She goes to Zumba classes. She goes running regularly. She goes out, and on weekends, she would eat in front of the TV or in the movie, enjoying movies. But her typical diet is a Western diet, the diet that we are so familiar with. Processed food, burgers, minimal or even no intake of vegetables. So my quick question was, do you take at least 2 cups of vegetables 2 times a day? The answer was no. It was not surprising. Her typical diet is pizza, spaghetti, microwave food, this typical Western diet, full of processed food, red meat, and no fiber at all. So it turns out this kind of diet produces the phenomenon of dysbiosis. What is dysbiosis? Meaning there's an imbalance of good bacteria or the microbiota with the bad bacteria. Diagnosis of early onset colon cancer, there's a specific bacteria that is implicated or associated with E. coli. E. coli, turns out, produces colibactin, which promotes the damage of the DNA and produces or predisposes the patient to colon cancer. Children who are infected with E. coli when they're young are notoriously predisposed to early onset colon cancer. This is the E. coli that produces diarrhea when you're a kid, and never unchecked, continued with the Western diet, minimal intake of vegetables. Microbiota helps in the breakdown of dietary fibers that the human body cannot digest on its own, producing short-chain fatty acids, acetate, butyrate, and propionate. This short-chain fatty acid is very important in healing of the gut. When your gut is labeled as a leaky gut, is in a phenomenon of having inflammation in the gut, where there is passage of foreign substances that get seen in the by the lymphocytes, producing antibody to these substances. The small intestine, for example, is a site of absorption of trace minerals. So in essence, if you have an unhealthy gut because of dysbiosis and leaky gut, your trace minerals, which is essential for immune function, is diminished. So in essence, this contributes to the lack of a healthy immune system. Other metabolic functions of the microbiota is the production of essential vitamins like vitamin K, vitamin B12, folate, biotin, and riboflavin. This influences the energy harvest from food, which can affect weight and metabolism. In effect, if your microbiota is diminished, the good microbiota, or there's a dysbiosis, you'll be prone to hypometabolism, which predisposes you to obesity. And there's a strong correlation of certain bacteria associated with Western diet that is associated with obesity and metabolic disorders, such as diabetes, hypertension. It also affects the immune system regulation. It trains and regulates the immune system, especially during early life. So if your diet is already established as a Western diet, there's a good chance that your immune function is very weak. You will be predisposed to certain infection, and it becomes a cycle because you get antibiotics, which destroys the microbiome, And in essence, you are proliferating this state of immune dysfunction. Not only that, this allows you to be or predisposes you to autoimmune diseases. And these are the examples of celiac disease, Hashimoto's, multiple sclerosis, systemic lupus erythematosus or SLE, or even Alzheimer's disease. Microbiota offers help by protection against the pathogen cystitis, especially the E. coli. It competes with harmful microbes for space and nutrients, and has a concept known as colonization resistance. It produces antimicrobial compounds that kill and inhibit pathogenic bacteria. So you'll think, many instances, you're predisposed, some patients are predisposed to developing acute diarrhea or infectious diarrhea, and some others are not. They're able to eat certain foods, and others are so sensitive that they develop diarrhea easily. And possibly this is because of the dysbiosis and lack of protection from the microbiota for the good bacteria. Remember, the microbiota is also involved in the gut-brain connection, or even the gut-brain immune connection. It communicates to the brain by the vagus nerve. And if you know, the vagus nerve is the main supply of the autonomic nervous system. Certain foods stimulate the sympathetic nervous system, which makes you in a fight-flight mood over a parasympathetic mood, which is resting and digesting. There is a relationship. When you're in a sympathetic overtone or a fight-flight mode, you are in a state of being anxious, as depression, anger. So you can make a case that even the state of your diet and the gut health predisposes those negative emotions such as anxiety, depression, and anger. Now remember, serotonin, which is the neurotransmitter responsible for happy mood, 60% of those are actually produced in the gut, not in the brain. If you don't have a healthy gut, this also affects the mood. Most important, relevant to our patient, is that microbiota modulates inflammation and cancer risk. So if your microbiota is not existent or having a dysbiosis or imbalance, some microbes like E. coli, as I have mentioned, produces colibactin that can damage the DNA and promote colon cancer. So this might be the focus of our attention. So it behoves you to be convinced that the plate is your medicine. Whatever you put in your plate affects your health. In the case of Teresa, she admitted that indeed her diet was primarily processed food, hot dogs, pizza. She drinks Coke regularly, or even different soda. She could not resist in terms of not being able to drink sweetened drink. Water is not her friend. So, in her situation, and many of our patients who are diagnosed with early onset colon cancer, the risk increases when you're indulging in Western diet. Western diet is also associated with mental disorders or depressed mood, anxiety, and other mental conditions. So in essence, the importance of healthy diet, especially high fiber diet, cannot be understated. Whole food, plant forward diet, like the Mediterranean and traditional Asian diet, which is rich in fiber, healthy fats, and phytonutrients, can help reverse many of these effects. It is not too late to learn from our patients. I wish I had followed a good and healthy diet, as what her mother had advised to her. But she is now in her stage 4 colon cancer. Treatment is there. She's being treated with chemotherapy and all other things that is available for her. But the lesson we learned is that diet is very important. The plate is our medicine. I offered her advice to engage in meditation. What is the relationship of colon cancer and meditation? Indirectly there is. Remember, the lack of microbiota diminishes the neurotransmitter of serotonin. It also decreases or predisposes you to mood disorder. Well, meditation, guided breathing and meditation helps reset your sympathetic overtone to parasympathetic overtone, focusing on the unconditional love of Jesus through his passion is the best way to meditate. With guided breathing and focusing your mindfulness on the unconditional love of Jesus allows healing of your heart, allows healing of what you have. It will help you with your anxiety, depression in the midst of the serious diagnosis that you have, like Teresa, where she is diagnosed with colon cancer. As it is, colon cancer is a bad diagnosis. But to live with it and learn to be happy or joyful in the midst of crisis is also very important. And that's how unconditional love meditation of reflecting on the passion of Christ will probably help. There is a relationship between diet, between meditation, and lifestyle. This is Dr. Raúl Enad from Cadenza Medical Clinic.